So in the U.S. right now, there are a number of regional coronavirus outbreaks that are accelerating in different ways at different paces. And of course, we brought you stories about this. We brought you a story before on this show about two neighboring states, Kentucky and Tennessee, as a kind of parable about the impact of acting to contain the virus relatively early, as Kentucky's Democratic Governor Steve Beshear did, versus acting relatively late, as Tennessee's Republican Governor Bill Lee did. And the numbers appear to illustrate the difference. Tennessee, which closed schools, restaurants, as well as businesses about a week after Kentucky, is currently reporting 4,634 positive cases and 94 deaths. Kentucky, which was much faster to institute such measures, is reporting just 1,452 cases and 77 deaths. But, there's something to keep in mind regarding this data specifically and all of the data that you're seeing. A lot of this seems to be reflecting testing rates. Tennessee has tested way more people, nearly 60,000, versus about 23,000 people who've been tested in Kentucky. Now, the percentage of the people who have tested positive in Tennessee is still higher, which is certainly significant, but the difference here is not nearly as stark as it first appears. And while Tennessee is reporting more fatalities than Kentucky, it also has more than 2 million residents than Kentucky. The point is that making comparisons right now with the data we have between places, between countries, between regions is just really hard. And I would say this, the granularity and the specificity of the data that we all have access to can very much give us a false sense of how much we really know about what's going on. We are still trying to sort through all this data and also just figure out how accurate the data may or may not be. But all of that said, one thing we can pretty well establish, and this is, I think, a consensus view of epidemiologists who've been studying this, is that states and areas that move early do better than states that wait. Consider what's happened so far in New York and California. Again, the states are running different numbers of tests. There's different levels of population density, and just broadly, nothing here is simple. Lots of variables, right? What's undeniable is that California officials acted earlier, and the state has had a less severe outbreak, and New York officials moved later and has had the worst outbreak in the nation. Both New York State and New York City specifically, both of them acted more slowly than they might have. And it has had real consequences. In a new story tracing New York's relatively sluggish initial response, the New York Times reports the former head of the CDC, Dr. Thomas Frieden, believes that if New York State and City had adopted widespread social distancing measures a week or two earlier, the estimated death toll from the outbreak might have been reduced by 50 to 80%.